Hello everyone, this is Shubham. Welcome back to my channel, and this video will be about the Crohn's disease. Actually, what is Crohn's disease? It is the inflammation of the GIT or inflammation of the GI tract with subsequent tissue damage. So usually it may involve whole GI tract, okay, which means that from your mouth till the anus, it may involve any portion of the GIT. But most commonly it has been seen that it is involved in the intestines, okay. Now, in the intestine, most probably it covers the ileocecal region. So, in most of the patients, it has been seen that it is covering the ileocecal region. However, any portion of the GI tract from the mouth to anus can be covered in the Crohn's disease. So, if you talk about the Crohn's disease, it is the inflammation of the GI tract simply. So, let me write over here. Inflammation of GI tract. Okay. Most importantly, just remember that it can involve from your mouth till anus. Any part of the GI tract can be involved in this, but most particularly ileocecal region. Ileocecal region is the most important one. Ileocecal region is the most common location for the Crohn's disease. Okay. Now, there are some risk factors which kind of persons are mostly susceptible for having the Crohn's disease. So let me talk about the risk factor as well. So if you talk about risk factors, so what can be the risk factors? Now the persons who are having the positive family history of the inflammatory bowel disease. Okay, so the persons who are having their if any kind of family member is already suffering from in the past, have been suffering from the IBD or the inflammatory bowel disease. So that person is can be susceptible, can be the reason for having the Crohn's disease in that particular person. So IBD, the positive history in the family members. Secondly, the persons who are in their young age, for example, in their 20s. So the persons who are in their 20s, okay, they are most susceptible for having the Crohn's disease. Okay, so these are some risk factors. And some white people, if you talk about the population, a white population is most susceptible for having the Crohn's disease. Now, talking about the presentation, what can be the symptoms of such patient? They will be complaining about the abdominal pain. Okay, abdominal cramping pain will be there. Watery diarrhea can be there, but that will be the non-bloody. In the ulcerative colitis, which is the differential of the Crohn's disease, in the next video I will be talking about the ulcerative colitis. In the ulcerative colitis, there is the bloody diarrhea. That is main differentiating factor among the ulcerative colitis and the Crohn's disease. So let me talk about the presentation as well over here, which is very important. Now, among the presentation, first of all, remember that cramping abdominal pain will be there. So, cramping abdominal pain. So, abdominal pain will be there. Secondly, watery diarrhea will be there. Okay. Watery diarrhea can be seen in such patients, but that will be non-bloody, remember. Usually if the bloody diarrhea is seen, that is indicating most commonly about the ulcerative colitis. However, in some patients there can be the bloody diarrhea, but it is quite rare. Usually if there is bloody diarrhea, it is mostly indicating about the ulcerative colitis. Okay. And what else? If the watery diarrhea is there, in that person, that person is more susceptible to lose their weight as well. So weight loss can be there. Weight loss can be there in such persons. Okay, so the persons might lose their weight. Now, after that, some kind of obstruction can also be there in the bowels. Okay. What else? If you talk about systemic symptoms, fever can be there. Some low-grade fever can be seen in such patients. Low-grade fever can be there. Okay. intra-abdominal abscess can be there. Now very important, perianal fissures or fistulas can be there. But very important is that in some patients, vitamin B12 deficiencies can be there, or even the fat soluble vitamin deficiencies can be there. Okay, so overall you can say that multivitamin deficiencies can be there in such patients. So I would like to mention over here that their fat malabsorption can be seen. Fat malabsorption can be seen. Okay. Now, if I am talking about fat malabsorption, what are the fat soluble vitamins? We are having the A, D, E, K. These are the fat soluble vitamins. So, vitamin A, vitamin D, vitamin E, vitamin K deficiencies can be there, as well as zinc deficiencies can also be seen. Vitamin B12 deficiency can be seen. So, vitamin A, D, E, K, vitamin B12 and zinc deficiency can be seen in such patients. Okay. Now I told you in the beginning of the video that ileocecal region is most commonly affected. If I am telling you about the ileocecal region, ileo means ileum, right? Okay. Most common site for the absorption of the vitamin B12 is ileum, right? So if the ileum is getting ruptured, or if the ileum is not working properly for the absorption purpose, because in the ileum there is many kind of food products, and mainly the vitamin B12 gets absorbed in that particular region. If the ileocecal region is having the Crohn's disease, if there is some kind of granuloma is there, or some kind of lesion is there, which means B12 will not be able to absorb. So B12 deficiency can also be seen in such patient. Okay. Now these are some symptoms. Okay, so this was about the symptoms of the Crohn's disease. Okay, so these are some symptoms of this. These were some intestinal symptoms. Okay, what about extra intestinal manifestation? What about other manifestations? If we talk about oral manifestation, some kind of ulcers can be seen. Okay, so in the lip, in the mucosa of the oral cavity, there can be aphthous ulcers. Okay, so I would like to mention over here that there can be aphthous ulcers which can be seen in the oral cavity. Okay, so I am just simply writing here mouth. Okay, so some kind of aphthous ulcers can be seen in some patients. And what are some other symptoms? So arthritis can be seen in some patients. Uveitis can be seen. What is uveitis? Uveitis is inflammation of uvea. Uvea is present inside your eyes. So mainly your choroid region, your ciliary body, and the iris. These three structures, these three components combinedly make up the uvea. And inflammation of that uvea part in the eye is called as usually uveitis. So in some patients, uveitis can be seen, arthritis can be seen, kidney stones can be seen. This is very important. So I would like to mention over here kidney stones. Okay, so I'm mentioning over here this thing that kidney stones can be seen in some patients. Kidney stones can be seen in some patients. Now, I told you that fat malabsorption is there, right? Fat malabsorption can be seen in such patients. Now, what happens is if the fat is not able to absorb, there are chances that it will be getting loose. Okay, it will be get rid from the body. Now, in order to do that, it will bind with the calcium. Okay, and you will lose the calcium as well. This patient will be losing the calcium as well. That's why this patient may have the tendency for having the hypocalcemia and the kidney as well. Okay, now with that, if you are losing calcium, oxalate is remaining there. Now these oxalates can be tracked down into the kidneys. Okay, and they can be stored in the kidneys. Okay, and they can form crystals over there inside the kidneys. So which may lead to the formation of the stones in the kidneys. Okay, so kidney stone can also be seen in such patients, which is very important. So these oxalates can be absorbed. Oxalate, they can form crystals in the kidneys. Okay, these oxalates, they may form crystals in the kidneys, and which may lead to kidney stones. So it's very important. Okay, now coming over to so this was about the presentation. Okay, coming over to the evaluation. What can be the factors? What factors can you see in such patients. So let me write over here that what can be the evaluation factors. Okay, for the evaluation purpose, you can check. You can go for the barium enema. Okay, now the benefit for the barium enema will be in such patients that you will be able to see the ulcers. Okay, you will be able to see some kind of problem with the structure, with the anatomy of the intestines. Okay, for example, if there is some kind of ulcer, if there is some kind of other kind of granuloma, it can be easily, if there is some kind of fissures in the intestines, it can be easily seen with the barium enema. Next thing which you can go for, which is the colonoscopy. Now the benefit of having the colonoscopy in such patient that you will be able to see some particular signs, okay, and which is very important. So I would like to add over here, let me drop this portion. Okay, so these are cobblestone mucosa. Okay, very important for the exam point of view. Skip lesions can be seen. Now, what does it mean, skip lesions? Skip lesions means, if there is particular kind of, if this part is the part of small intestine, let's say, okay, and this portion is having the Crohn's disease, they are having some kind of skip lesions. So how the skip lesion will be forming? Let's say these are the lesions. Okay, so these lesions are present in the pattern of skipping. Okay, so that's why, because this lesion is skipping this part and this lesion is skipping this part. So that's why this kind of pattern we say it as skip lesions. This kind of pattern is seen in the Crohn's disease. Okay, so that's why I mentioned over here this is skip lesion, which can be easily seen by the type of colonoscopy. So colonoscopy is quite a good method for the evaluation purpose as far as Crohn's disease is concerned. What else can be seen? Cobblestone mucosa, skip layers, transmural granulomas can be seen. Transmural granulomas can be seen. Now, what does it mean, transmural? Transmural means all the layers of the intestine can be involved in the Crohn's disease, whereas in ulcerative colitis, all the layers generally are not involved. That is also a good differentiating factor between the Crohn's disease and ulcerative colitis. In the next video, I will be talking about the ulcerative colitis as well. So, transmural granulomas can be seen with the help of colonoscopy in the Crohn's disease. Okay, so that is about the evaluation. What about the lab values? So, in the lab values, by checking about the CBC, you may find out that this patient may have a deficiency of vitamin B12, because as I said that ileocecal region is the most common location for the Crohn's disease, so vitamin B12 deficiency can be there. So, while checking the lab values, so let me go over here and let me mention those things. So, while checking the lab values, you can go for CBC. So, while checking the lab values, labs, what can you find? You can go for the CBC, and in the CBC you will see the vitamin B12 deficiency. Okay, with that macrovalocytes can be seen. Macrovalocytes can be seen. Okay, and that's what megaloblastic anemia, right? Macrocytic anemia. Now, with that, hypersegmented neutrophils can be seen. Hypersegmented neutrophils can be seen. Okay, with that, methylmalonic acid, so serum elevated serum methylmalonic acid can be methylmalonic acid, as well as homocysteine levels. So homocysteine levels can also be elevated. Homocysteine levels can also be elevated in such patients. So these are about the lab values for the Crohn's disease. Okay, in the evaluation. What is the differential? Differential will be the simple one, ulcerative colitis. I told you the differentiating factors as well. What about the treatment? For the treatment, You may have, so let me talk about the treatment as well over here. Okay. For the treatment, you use the steroid, for example, prednisone. Okay. You can go with the sulfasalazine. Okay, sulfasalazine, mesalamine. What else? Infliximab can be helpful in some patients, and lastly, those patients who have the transmural lesions, usually who have the transmural granulomas and who are having the extending lesions in the GIT, they have to go for the surgery. They have to undergo the surgery process in which there can be the removal of some portions of the GI tract. Okay, wherever there is a transmural granulomas, for example. So lastly, this patient are having the option for the surgery. Okay, what can be the complications? Complication can be intra-abdominal abscess, and there can be the problem for the vitamin B12 deficiency, because as I said that in most of the cases vitamin B12 deficiencies can be there. Okay, so about the complications. For the complications, these patients may have the intra-abdominal abscess in some patients. Okay, so intra-abdominal abscess can be there. Intra-abdominal abscess or vitamin B12 deficiencies can also be seen. Okay, and as far as complications are concerned for the Crohn disease. So this was about the Crohn disease. I hope it makes sense and it will be helpful in preparing for your exams. In the next video, I will be talking about the ulcerative colitis. This was about the Crohn disease. So we will be comparing the ulcerative colitis with the Crohn's disease as well. So see you in my next one. Thank you so much.